hospital and tried to find buy-in from infectious disease and many other physicians. That's always where the buy-in comes into play. And so the ED became my area of choice. It's a very highly contaminated, well-versed, accessed point of entry for the hospital. We know that there's a lot of people that are around that are being exposed, from EMS workers to families to trauma, right? So a lot of patients that have a lot of significant multiple casualties that were there. So I decided to put this product to use, and so that those discussions came a lot of background. You know, is everything focusing on just hand hygiene? Is there a way that we can reduce contamination across the spectrum? While I feel that humans create most of the problems that we have, I also felt that the inanimate objects, and I think Linda did a really good job of talking about the structures and the other items, the other objects that are there. So that was one of the big key elements. And we know right now that hospitals are on a hand hygiene mantra, right? And I've even watched some healthcare facilities where disciplines are calling out other disciplines in front of patients to tell them that their hand hygiene wasn't done. So it's kind of become a little neurotic, and I really think it doesn't allow for us to work intercollaboratively. The other two pieces that are critical to this was, of course, glove retrieval practice, right? For some of you in the room, you're nurses, you have background with that, knowing that you never were really properly taught, that you really don't have to stick your entire hand in the box, or when the box is half empty, in order to retrieve a glove, that you need to stick your entire hand in there. So with that comes some cross-contamination, which is a major issue. And then, of course, the glove box design. I mean, I've done a lot of research looking at it and trying to figure out, does the contamination of the gloves, does it come from the way that the gloves are actually partitioned in the box? Are they from the easiest area, from either, some of them are manufactured with fingers through, or the outside of the gloves coming out so you can manipulate them? So that became a nice discussion point until I had the buy-in from the hospital. So my purpose of this whole thing was to study, to look at the two different designs in the department setting, into the emergency department setting. I had an outward-facing and a downward-facing glove boxes. What I actually did is I stuck these underside retrievals, because that was different from the outward retrievals, into 3 additional emergency room department into the rooms. I didn't tell the staff. I wanted them to try to manipulate and figure out if things were going on, because again, there's a big hand hygiene, initiative going on, so I wanted to see if they could understand the difference of it. So my methodology is on the screen. On day 1, I opened up the box, I wrote on the back of it with a Sharpie, I put it in the containers, had everything ready to go. And so staff had an opportunity to pull gloves just as their regular practice and to see if there was anything there. Over the next couple days, me, myself, and I went to each of these glove boxes. I sterilely pulled out a glove that would have been either the next glove that was available, and I stuck them in a container, and then of course transported them over to my Rita Hewerts, Dr. Hewerts from St. Louis University microbiology data. And of course that was, she actually put an auger and let them sit at a perfect room temperature, just like we would normally do in the hospital setting. I know this is a bad slide, but I have to show you, and it doesn't take very much to show you that the outward facing, so the traditional glove box, is on your left, the downward facing is on your right, and what you can see in a spot check is that there's way more colonies on the left side, which is the outward facing, the traditional one, versus the other 2. So even in that, in week 1 and week 2, you start to see a major difference coming out of that. So what did I find? Well, there were 3 natural bacteria that came out of this whole thing. Bacillus, and of course some of your staph and your Corynebacterium, all very normal skin flora. I was very thankful that we didn't find MRSA. I was very thankful that we didn't find C. diff, right? Because in this whole element of things, you always want to go for praying that nothing really was going on with the staph, because that would have been monumental. But other things that came out of it that are huge, first of all, we had a contamination rate of about 27%. In all the studies that I had read, there was a contamination rate in most of them from 30 to 40%, so it was much lower, which spoke volumes. So the hand hygiene is working, right? It's definitely doing an element there, because this campaign in this level 1 trauma hospital had been, again, really doing good surveillance on making sure that healthcare workers were doing that. But you can see that the outward-facing contamination was 16%, while the downward-facing had 10%. We're always going for the lowest number, except when you're trying to get a big value for your meal, right? That's always the difference. This is also very startling, was the quantity or the numbers of the contamination, right? So you can see that the outward-facing glove box was contaminated with 82% of the total sample size versus the downward-facing. And you can also see that the outward-facing had a total of 32 colonies of growth in the 31 colonies grown in the first week. The second kind of really crucial element here is that the downward-facing had 7 colonies, with 2 colonies that were grown in the first week, compared to 5 colonies in the second week. So what does this mean? All right, so I throw some stats in here if you're there. It means that we did see a very significant difference in the mean score of the growth between the 2 boxes. So the boxes were different. And that was a very moderate significance, so that is another big take-home message with it. I do want to mention that with this came a lot of funding. The funding was really crucial to this. As you know, it's expensive to try to grow microbiology data, use a lab, and do all of that. So I'm really happy that I applied for a grant at St. Louis University. And on the flip side of it, I really want to give some kudos to the downward-facing glove dispenser, which came from Plasticos. So that was really important for me to go forward with this study. In conclusion, two major things that came out of here is that we are doing a good job with hand hygiene, but we need to stop and we need to look around our facilities and take the time to look at what are the other elements that are impacting this, right? So we do a really good job, especially out in our surgery centers, to mitigate a lot of the colony growth by a lot of excellent, care in the environment. But I think it's crucial that we take a stop for a minute and look at these glove boxes and consider the way that we're actually moving forward into the next century. Thank you.